of Ohioans. And as I noted previously, driving hospitalizations and deaths, particularly among our most vulnerable. And based on long experience in tracking these respiratory illnesses, it would not be at all surprising for us to see still another surge in one of these illnesses. We still have a lot of winter ahead of us, and therefore, we still need to do our very best to assure we are all protected. And when it comes to COVID, we know that too many Ohioans who are at the highest risk, those over the age of 65, still have not taken advantage of the opportunity to protect themselves by getting an updated booster. To reinforce the risk, consider that more than 100 Ohioans are dying of COVID most weeks. That's about 15 deaths a day on average. And those deaths are mostly among our older residents. Nearly 4 out of 5 COVID deaths in Ohio, 79%, have been among those 65 and older. And if you lower the age threshold just a few years to 60, that includes nearly 90% of the state's deaths. Now, I've talked often about the importance of vaccination and of staying up to date with those vaccinations, which means getting the recommended boosters. There are numbers to back up the importance of this. As of November 2022, the CDC reported that people who have received the updated booster were 12.7 times less likely to die than those who were unvaccinated. And the statistic is less dramatic, but still informative, that the CDC reports that those who received the updated booster were 2.4 times less likely to die than those who had only completed their primary series of the vaccine. A recent CDC report stated that nursing home residents who were not up to date with recommended vaccines had a 30 to 50% higher risk for COVID-19 infection compared with residents who were up to date with their COVID vaccines. The reason for this is that boosters do just what the term implies. They boost immunity. And in particular, evidence has shown they're very good at boosting the cellular immunity that's crucial to fighting off COVID-19. Another way of saying this is that a booster might not prevent you from catching COVID-19, but it sure will help you fight the bug and give you a much better chance of avoiding getting really sick or dying from COVID-19. Even as the virus continues to mutate into different subvariants of Omicron, such as the recent rise of XBB, CDC data is showing that the updated booster continues to be effective against symptomatic infection. Now, immunity can wane over time in anyone, but as a natural product of aging, immunity fades more quickly in many older adults. That's why it's so important for this population to get all the help they can from vaccines and boosters. For the last several months, we've used one formula for the primary vaccination series and another, the updated bivalent formulation, for our boosters. Now the Food and Drug Administration has signaled that it's moving towards simplifying this and having a single formulation of the vaccine, in this case, the newer bivalent vaccine, that will serve for both the primary series and the booster. Indeed, after a careful review of all available data, the FDA's independent advisory panel affirmed that the updated booster is safe and provides strong protection against this virus. Yet, only 15% of Ohioans have received an updated booster. And perhaps most importantly, only about 41% of Ohioans who are 65 or older have received it. This is leaving too many people vulnerable. And sadly, it means too many of us are taking unnecessary risks, and that many of the roughly 100 deaths a week in Ohio are in fact preventable. Now, I would also like to highlight an effective treatment that we have if you do test positive for COVID-19 that can also reduce your chances of getting severely ill or requiring hospitalization. And that's a treatment called Paxlovid. Paxlovid is an oral treatment and it's readily available. You need a prescription, so it's very important that you call your healthcare provider as soon as you test positive, even if your symptoms are mild. Remember, the sooner you can start this treatment, the better. Again, I want to emphasize this treatment is effective and available, and like the updated boosters, it's especially important for the more vulnerable, the elderly or those who are immunocompromised or who have other chronic health conditions. Now, I want to turn to our guest, Dr. Tanya Garay, Associate Professor of Clinical Medicine and Section Chief, Geriatrics at The Ohio State University Wexner Medical Center and College of Medicine, to discuss the importance and availability of COVID-19 vaccines for older Ohioans. Good morning, Dr. Garay. Thanks for joining us.
Good morning.
Could you talk a little bit about what you're telling your patients about the risks and benefits of getting the updated COVID-19 booster, especially your patients who are over the age of 65?
Well, I'm a geriatrician, so I take a lot of pride in my work caring for older adults across the different spectrums of living settings here in the clinic, in the nursing home, in congregate living settings and like assisted living. And I spend a lot of time talking about vaccination with seniors because it is so important to remain updated on your shot series. And we know that the uptake within the state has not been great. And so I know that it's top of mind whenever I talk to my older patients. I try to create a comfortable setting where we could discuss what the current vaccine status is of the patient, and to give them an open opportunity to talk about concerns, questions, how they might benefit, what's the gain after having so many prior shots, or if they haven't started at all, how to get started. And I try to put it in the context of what their values and preferences are: staying healthy, staying well, living long, preventing illness to their loved ones. And so those are what I really try to emphasize in my discussions, and hope at the end that there's a plan that we can develop, a concrete plan to get updated.
Thank you. Now, when it comes to actually getting the shot, where are you advising your patients they can go to get the shot? What are some of the best options for booster locations?
Well, depending on where I'm providing care for the patients, some of them are directly accessible, like in many senior living communities. They've done an outstanding job of providing access to the vaccinations and providing coordinated opportunities for individuals to be vaccinated or caught up if needed. In the clinic, sometimes the vaccine is not immediately available in some certain clinics at The Ohio State and other medical centers across the state, but there are locations where they can go. Scheduling is very easy, either through a patient portal or going to local pharmacies to schedule. Walk-ins are actually easy to accomplish at many local pharmacies.
Thank you so much for that information, Dr. Garay.
You're welcome.
Well, as we wrap up today, I want to build off what Dr. Garay was saying and provide a little more detail on where in Ohio you can go to get an updated booster shot. Over the past 2 years, the Ohio Department of Health has worked with providers to build a large and robust network of locations. Perhaps the most convenient for many people are our major pharmacy chains. And the good news is that the majority of these locations are offering walk-in vaccine opportunities, no appointment necessary. Now, majority does not mean every location, of course. So it's a good idea to call ahead or look online and see if a specific location that you're interested in is accepting walk-ins, or perhaps has an opening for a same-day appointment. Also, vaccines are available at local health departments across the state. Departments located in small towns or rural areas may require you to make an appointment, or they may have scheduled vaccine clinics, but most of our larger health departments will also allow walk-ins for vaccines. Older Ohioans or their caregivers seeking more information about vaccination can call 1-866-243-5678 to connect to the local area agency on aging serving their community. And ODH offers a one-stop location online where you can search for places that are offering the vaccine, and it's gettheshot.coronavirus.ohio.gov. That site is appropriately named as it emphasizes our message today: get the shot. It could save you from serious illness or a hospital stay, and it could even save your life. Thank you, Ken. I think we can now take questions.